I now have the honor of introducing my colleague, who I have been trying to get to Los Angeles since the moment I got to Washington, D.C. And people ask me all the time, how do you put up with that environment that you're in with those mad folks from the Tea Party? Well, one of the ways that I am able to do that, and one of the reasons why I'm excited and honored to be in Congress, is because I get to work alongside a giant like Congressman Jim McDermott. As soon as I got to Congress, I learned about his accomplishments in child welfare, but let me just mention a few other things. First, he is a child psychiatrist by training, served in Vietnam, came back, and ran for a seat in the state legislature in Washington, and then served there for 15 years, and then left after that and went to Africa and worked in Africa. So we work on two key issues together, both child welfare and U.S.-Africa relations. And well, after serving in Africa for a while, he came back and then ran for a seat in Congress and is now serving his 13th term in Congress. So as somebody who has been in Congress, that has all the experience, that is more than willing to guide a newbie like me, I am very excited to work with him, and everybody in this room knows of his work, maybe in the long term, but most recently in California with AB 12. The federal policy was called Fostering Connections. He's the author of Fostering Connections, and in California, as we implement it, it's AB 12. People mentioned to me during the break their concern about psychotropic medications. Well, you soon learn that that is certainly an area of his expertise. But join me in welcoming my good colleague from the state of Washington, Congressman Jim McDermott.
With an introduction like that, I ought to just sit down. Thank you very much, Karen. I am very pleased to be asked to come out here and talk. I was looking at the colleagues who've been up here, and you've had really a very interesting group of people up here. You have an African-American woman, you have a Chinese woman, you have a Hispanic woman, and a white man. It's a full hand to draw to in this society. And it is, all of them have done wonderful work, and Karen, if anything, came over-prepared for the Congress. She knew too much, and so she immediately went to work on guys like me who've been there for a long time, working to work on the issues that she really cares about. So it's been a real pleasure to work with her, and she started the foster care caucus, really. I mean, I've been there fiddling around for 20-some years, but she actually came and started the caucus. So she gets the credit for doing that, and I think you should all give her a hand for that. My only reason for being here, I think, is because I'm an expert. An expert is somebody 50 miles from home with a briefcase. Everybody else is within 50 miles of this place, so you can't qualify like I can. But as I drove into this place this morning, I looked at that sign over that Marydale, and I thought to myself, in 1963, I drove into the first children's residential place that I ever worked at. It was called Allendale School outside Chicago. So I've been working in this field for a long time. I've seen lots of things, and seeing a group like this is always energizing to me because you are the people who are actually on the ground doing the work. And sometimes the cynicism of Washington, D.C. Is a little overwhelming. It's always good to come out in the field and see people who are actually doing good things on a daily basis. Karen and I and Adam and sometimes wonder exactly why we're back in Washington. But you know on a daily basis what you're up to. And I really think that I finished my residency in child psychiatry. So this is not a field that's foreign to me. I learned about, that every child psychiatrist asks a kid, what are your 3 wishes? Always the first wish, what is it? I want to go home to my mother, right? I mean, I learned that because I worked for 8 years at the reception center in the state of Washington, dealing with the juvenile justice system. All the kids in the state of Washington come to one place, and then they're distributed out to the residential settings. So I saw everybody and lived long enough in the system to then see some of them down in the penitentiaries. I saw what the history is of kids in this system. And whether it's expecting foster kids to go it alone at 18, or denying them grandparents who become legal guardians, or unnecessarily displacing them from their schools, or separating them from their siblings, we have done so many things wrong in the past. This breaking the links that youngsters have to successfully navigate their life is the fundamental thing that we have to deal with. How do we reestablish some stability for these kids? Many of you are aware of the studies by Mark Courtney at the University of Washington and at Chapin Hall. And I'll give you statistics. You heard some before. I'm only going to give you 2, okay? One of the most notable findings was that by age 24, only 6% of foster kids who had aged out of the system have completed 2 to 4 years of college. Now, I live in a district, the most educated in the state of Washington. 55% of the people have a bachelor's degree or higher. And we're looking at a group of youngsters where their chances are nowhere near that kind of thing. 40% of those kids in that study were making much less than all their peers. And providing a roof over a kid's head is not enough. You gotta accompany that with the necessary medical and physical, job services, educational services, and most importantly, the human connections that we all get by. How many of you remember yourself at 18? Were you ready for the world? I mean, I don't even want to talk about me at 18. But I'm sure that many of you remember the time when we had a system where we would read newspaper articles that would say kids were lost in the system. New York had 500 kids they couldn't find, or Washington, D.C. had 100 kids they couldn't find. They were put into the system and just simply slipped out of sight. Now, in 1980, the Congress passed the Adoption Assistance and Welfare Act, which was supposed to remedy this problem. But passing a law doesn't do it. And you're the implementers. A lack of political will on the part of the Reagan and then the first Bush administration led to increases in the number of kids in foster care, in spite of this new law that we'd passed. During that period, the system was overwhelmed by homelessness and drug epidemics, and then came AIDS. So we had a whole new wave of problems. Terms like crack babies and border babies, there was infants that were abandoned in hospitals, became the normal because children were entering a system that was simply not prepared to deal with them. Now, the late 80s, and I'm giving you some history so you can see where we've come, because sometimes people get kind of down in the dumps when they look at what's going on today. Let me tell you what it was like before. I remember when I started in the legislature, you didn't even have to report sexual abuse. Mandatory sexual reporting did not happen until the mid-70s. Well, in the mid-80s, we saw a proliferation of class action suits. Advocates like yourself decided the only way to do this is to go to court and get what the law says these kids are entitled to. And we had people at that point who were sleeping in offices of social workers because there was no placement for them. It was a system that was really very broken. And some of those problems were addressed in the act of the Adoption and Safe Families Act of 1997, when we started putting timelines for care and national goals for children and called for innovative approaches to meet these needs. When I came along to the Congress, every once in a while in the Congress, somebody gets assigned to a committee about which they know something, right? Instead of putting a guy like me on the farm committee to look at wheat exports, I wound up with family support and child welfare. in 2008, and we brought a bill. That's where Fostering Connections came from. It was sort of taking all the things that we could see out there that hadn't been dealt with and sort of saying, okay, we're going to put it in federal law, and we're going to give the states a place to shoot for, and and then places like California take off and do as they do. It really provided for additional services and support for kids in foster care, and it also allowed kinship care and things that prior to that there had been no recognition of kinship care in the federal system. It allowed states to go back to raising kids up to the age of 21. I remember when we gave the voting rights came down from 21 to 18 because we figured if you're going to go to Vietnam and get shot and can't have a beer, you ought to at least be able to vote. And so we gave them the vote, right? And then we sent them to Vietnam. Well, this was taken by state legislatures. Well, now everybody's an adult at 18. So they dropped their foster care down to 18. And it was, budget cutters always have a way to explain why they did what they did. It was bad for kids when we did that. It was a bad move because it's simply not the real world. Now, whether they're undervalued or just overlooked, we often expect kids in the foster care system to overcome more than we would ask those who are outside it. The Affordable Care Act, which we just passed, rightly recognized what many of us have known about children who are not independent once they turn 18. I mean, you know how many kids have these drugs that people are giving to these youngsters, and then suddenly they get to 18 and they go boom, because they don't have Medicaid anymore. They don't get their medication anymore. It's gone. And so we got it into the law, the Affordable Care Act, which we're now implementing for the country, and said that they had coverage till they were age 26, just like you can do for your kids. Every parent in the world was worried when their kid left college and had no health insurance. What do I do now? And so now we allow them to stay on beyond college up to 26. Why not kids in the foster care system? Mary Landrieu, the senator from Louisiana, had a terrible fight, but that was her issue. She wasn't voting for the Affordable Care Act if they didn't put foster kids in to the age of 26. That's not giving them, yeah, you can wave your hands. You could even clap for that. It was a real gutsy move on her part. But that's not giving special treatment to foster kids. It's just giving them the same treatment that we would give our own kids. And we often kind of separate out these foster kids are somehow different than our own. And, any of us who've been parents, all of us who've been parents, know the things that sort of keep on hanging on as they get a little older. They're certainly independent. They don't need you, and they don't need your advice and all the rest. But then they come around asking questions or bringing stuff around, and you know. Now, that provision of health care is through the state Medicaid services, so there's still problems. You know that, and I know that. Especially because as these kids like mine, I got one living in Amman, Jordan, and another one living in California, and they're moving all over the country. Foster kids actually move too. And if you're in CalMed and you move to Connecticut for a job, you lost your health care because CalMed doesn't take you when you're in. And so we've got a system now where they have it in law that they can have it, but we haven't made the other connections so that you can take it with you out of state. And that really is one of those things that has to be done. In addition to the Coverage 26, the Affordable Care Act gave mandatory funding for evidence-based home visitation programs to help new mothers adjust to parenthood. Another prevention plan that got put in by Danny Davis from Chicago. He knew it worked in Chicago and said, I want this into the Affordable Care Act. It's another one of those places where you put some money in up front and prevent some of the problems that come along in the foster care system. It really improved the oversight of health and education for youngsters all along the way. Now, in the midst of all the stuff you read about Washington, D.C. and what you hear about it, it is still possible to get things done. And I only experienced legislators like Karen Bass and Hilda will really understand this. You have to find out what that other person really wants. And if you can figure out what they want, then you can present them with something that might have a mutual benefit. And I was still on the committee dealing with this stuff. The waiver bill that gives 4E money to states to be used for other than out-of-home placements, that waiver bill that California is using, got through on a consent calendar. There wasn't a vote against it in either the House or the Senate, because we figured out a way to make everybody see there might be something in this for Kentucky. So Mitch McConnell thought it was a pretty good idea. And we found a bunch of different ways to make some things happen, because you can, and there is hope, and there is the ability to move forward. Partly, I believe, and this is one of the things that's amazing about this whole field of foster care, it is not a partisan issue. There aren't Republican foster kids and Democratic foster kids. There are a lot of kids who got dealt a bad set of parents, or a set of parents that couldn't make it work or whatever. And so there's not this kind of blame game about what we should do. It's a poor kid who's got a problem, and we got to take care of him. And so there's a coming together, and I would encourage all of you to talk to every member of your legislature. I know I'm talking mostly to Californians, but don't exclude anybody, because everybody there can be touched by the kinds of stories that you tell. And I could stand here and tell you stories till you'd all go to sleep. But the fact is that they need to understand who these youngsters are and what they're really coping with. I remember, I'll give you one. Jewel came before my committee. She's that country western singer, I guess some of you may know. She was a foster kid who got a scholarship to a college in Michigan, and you know, she starts out the first semester and away they go. They get to Thanksgiving, they close the school down, right? Everybody's going home to Thanksgiving, right? She didn't have anywhere to go. She slept in her car in the parking lot of the dormitory for 3 days until school opened up again, and she could get back into the dorm. That's the kind of stuff that goes on in this society, where you have all sorts of youngsters who have the capacity to do stuff, but they need a little help and a little bit of understanding of the particular situation they're in. And we finally we got a second bill through to look at psychotropic drug administration in kids. We had a number of hearings, and the stories are awful, and as a child psychiatrist, they're really aggravating and irritating and angerifying. But then the question is, well, what can you do from the national level? So we said that we wanted all the foster kids. I was the godfather for 500 foster kids in this country. And my job was to figure out what's good for 500,000 foster kids. And so we put in a provision that the medical records had to have a plan for how they were going to administer and review the use of psychotropic drugs. Now, it's in law. Now, Los Angeles County actually has a mechanism by which they try to do that. I can tell you, I bet you there are half the counties in California have not done what Los Angeles County has done, because it takes some thinking in how you're going to get somebody to take the prescription and review it and then give it to the kid. And is it the foster parents that make the decision, or is it the school that says the kid should be on medication? Or who is the responsible adult for a foster kid when you come to this issue of psychotropics? So it is not an easy problem to work out, but you people are down at the level where you can come up with the proposals to go to your state legislatures and say, here's how it would work best. It would work a lot better, or maybe even ask the kids. You know, there's a rule in medicine that every doctor learns very early on. Listen to the patient. He's telling you what's the matter with him. And so often we decide what's the problem with somebody, looking at them by what we observe or whatever, without asking them, what's going on here? And that's really, I think, what we're trying to do. Now, the state waiver is really, again, we tried to give some flexibility to states. And so it's now up to your creativity to figure out how to use the money. We used to give money, of course, just to take a kid out of a home and put the kid into a foster home. Well, then we figured out, well, maybe we can put him in grandma. Why can't we pay grandma the same thing we pay the foster home? Well, you know what the rates are in California for grandma and for a foster home. They're not the same. And those kinds of issues we've got to keep pushing on, because I don't think that progress on paper is everything. We really spent the last 2 years shredding the safety net in this country, when all you have left, when you're wiping out Head Start and you're wiping out food stamps and you're wiping out all these things, and you have states where the governor won't even take the money for more Medicaid money. I mean, you ask yourself, what is a governor thinking about? Like this guy in Texas. I ain't from Texas, okay? Now, in my view, there are some states that are now taking less active role in going out and investigating cases because it costs some money. To me, that is the height of irresponsibility. If you get a report, somebody should be out there seeing what that kid's needs are. And it's not charity here we're talking about. It's not charity. The research for Partners for Our Children showed that in California, every dollar spent keeping kids out of foster care until age 21 yields $2.40 in return if the kid gets a bachelor's degree, and $2 for every buck invested if they get some college. So we're talking about long-term investments here. And the short-term, well, we haven't got any money today you're going to spend it one way or another. It costs, what, $40,000 a year to keep a kid in the California institutional system, this prison system? So you want to spend it that way, or do you want to deal with the kid up front? And that's really where I come down, because every kid that graduates is somebody less on food stamps and on welfare and on all the thing. It's one less body in a shelter or out selling their body for sex, because that's the only way they're all the things that go on in this system. Now, we need really to build up families and to invest in them. That's really, because we're really investing in our future and our workforce. We have to have workforce. All this immigration stuff, or a lot of this immigration stuff, is about, we don't have enough people. So we got to bring in people from all over the world to come in, because we're not investing in our own kids. And to me, that's the real tragedy of this. Now, there are some, I'm proud of some things that are going on in the state of Washington. I want to just talk about one of them. Something called the Mockingbird Society. A guy up there said, he was dealing in all this, and he finally said, I'm going to put this thing together. And they have a youth network. They're using young adults to come in and mentor and support kids who are in the system. They share stories. They work in local businesses. They work on civic projects. They become leaders. They actually do their own newspaper. Kids will write articles for the Mockingbird paper, which goes out all over the part of Washington I live in. They've also founded an innovative way of dealing with families, creating community. They take 6 to 10 families and involve them in a system of where there's foster or adoption or kinship or birth ties, all these houses where they've got these kids with problems, and they create this constellation of homes around a licensed foster home. And they then use that, what they call hub home, as a way to provide assistance in navigating the bureaucracy and peer support and social activities and respite care. God knows people who deal with youngsters with problems occasionally need respite. I mean, I certainly wanted respite for my kids on occasion, and I'm sure that what this group does, because there are these 10 homes that are all associated around this hub, when somebody needs a day off, there's somebody around to say, hey, go get Charlie to come and see if we can't work this out, and take some pressure off. And breaking up that isolation of families and caregivers is a very good, has very good results. They had their report out recently. 100% of the kids in that program were free of abuse and neglect. 83% were kept in their homes. There was no placement move. 1% ran away. Caregiver retention was 88%. The national average is somewhere around 50 to 70%. When you give people community and some help and don't leave them alone in a little isolated foster family trying to deal with a horrendous kid, you then begin to make a system that begins to work. And I think that the thing that's hardest in all of this is understanding how much we've lost a sense of community in this country. And building that back in through the foster care system isn't easy. I mean, I've lived long enough to not think that it's gonna be all done. But I continue to think about, Bobby Kennedy used to quote a quote from George Bernard Shaw. Some people see things as they are and ask why. I dream of things as they never were and ask why not. Karen is a dreamer. Adam Schiff is a dreamer. Judy Chu is a dreamer. Hilda Solis, you ought to be dreamers. Thank you.